Hi, I'm Dr. Dave Novatnak, and today we're going to talk about neck pain. Some of the common symptoms of neck pain, of course, is pain in the neck. Other symptoms are stiffness in the neck. You have a hard time turning your neck, and that could be turning your neck left to right or moving it up and down. Other problems are dizziness. A lot of times people come up with neck pain and they'll say, oh, I'm dizzy too, especially when I stand up from a seated position or sometimes going around a corner. Another problem is that they get pain across their neck this way onto their shoulders, and this could be onto one shoulder or both shoulders. Sometimes the pain goes all the way down even between the shoulders. Fourth problem that we often see with it is headaches. And usually those headaches, the people tell me that the headaches seem to start at the back of my neck and come up over the top of my neck. There's a lot of issues with headaches and neck problems, but there's a certain amount of headaches that actually come from the neck. And the last thing, and probably the most serious thing, if you have neck pain and you have tingling down your arms, it could be both arms or one arm, and sometimes it's just into certain fingers, that's typically a more serious neck problem, and there's probably disc involvement with that, certainly nerve involvement.
Doc, I have a question. Does neck pain always come on quickly, like from a car accident?
No. Most of the time when people come into the office, they tell me that the pain came on very slowly. They say, I didn't do anything. And that's for the most part true, from their perspective. But typically, they may be sleeping with reading a book before they go to bed at night, and their head's jacked up on pillows and they fall asleep that way, or else they fall asleep watching TV, sitting in a chair. Some people do a lot of desk work with their head down, or a lot of computer work, sometimes just playing games. And the more that you do work or get into postures with your head forward is what seems to bring the neck problems on. So typically you have the problem to start with, the postures and the activity that you're doing help to bring it on. Can you come here, Rose? So a lot of times what we see is slouching, that there's weakness, or tightness rather, in the chest muscles, weakness across the back, and the head goes forward and like that. And if you see a lot of older people around, you'll see that posture. They're just kind of like humped over. When that happens, that creates a lot of pressure here in the neck. So along with the typical treatments that we do, the long-term solution to this is strengthening the back muscles up, getting them back to where they should be, and strengthening the deep neck flexors to bring the head back like that. And that takes all the pressure off the neck. Thank you, Rose.
Can a stiff, painful neck lead to a pinched nerve?
Absolutely. Typically, like I said, these things start very slowly, but as somebody has that posture for a period of time and it keeps degenerating, eventually a disc can herniate and start to pinch a nerve. At that time, that's a more serious problem. And when you have a pinched nerve, typically you'll have tingling or numbness down into your fingers.
I have crackling in my neck. What does that mean?
Well, that usually means that your neck's not working right. Your neck should be able to move fairly freely without cracking and popping or anything. So when that starts to happen, that means that you've got poor mechanics in your neck and your neck's starting to degenerate. And most of the time we see that with that forward head posture. That's what has to be corrected.
And what is the best treatment for a neck pain?
Well, according to Consumer's Report, most people are most satisfied with chiropractic treatment and physical therapy treatment. Because it's a mechanical treatment, it starts to correct the problem. It just doesn't cover up the symptoms like anti-inflammatories do. So if you have a problem with a stiff neck or a painful neck, give us a call at Doctor's Choice and we'll be happy to take a look at it for you and tell you what we think.